हेलो एवरीवन, वेलकम टू Infocula. Daily dose 5 में आपका स्वागत है. Let's get started with today's 5 MCQs. All of the following are true for hypertonic solutions except A. Indicated in therapy of diabetic ketoacidosis. B. Hypertonic solutions hydrate the cells while depleting the vascular compartment. C. It is indicated in therapy of trauma cases and burns. And D. They can cause sudden fluid shift and raised intracranial pressure. Since the question emphasizes except, the statement here which is wrong is C. It is indicated in therapy of trauma cases and burns is the wrong statement. In cases of burns, trauma, malnutrition, and liver diseases, using hypotonic solutions can cause third space intracranial pressure. Also, there can be sudden fluid shift into the serous linings of body. A hypotonic solution is a solution which has less solute than the relative fluid around it. If there is lesser solute, there will be transfer of solute from the compartment next to it into that solution. This takes place when hypotonic solution depletes the vascular compartment, and the vascular compartment is depleted as there is transfer of material of solutes into the hypotonic solution. Hence, option number B is correct, and it is also indicated in therapy of diabetic ketoacidosis. Moving on to the next question. CNCA positivity is specific for A. Churg-Strauss syndrome, B. Wegener's granulomatosis, C. Hinoch-Schnollin purpura, and D. Polyarthritis nodosa. And the answer is Wegener's granulomatosis. CNCA का C stands for cytoplasmic, and ANCA as in anti-neutrophil cytoplasmic antibody. Now this CNCA follows a granular cytoplasmic staining pattern under microscopy, and the protein that it targets is called PR3 or proteinase 3, and this is seen in patients with Wegener's granulomatosis and sometimes in polyangiitis. Question number 3 is mechanoreceptor for stretch is A. Ruffini's, B. Merkel's disc, C. Pacinian corpuscles, and D. Meissner's corpuscles. Ruffini's is responsible for stretch. Merkel's disc is a slow adaptive mechanoreceptor for touch. Pacinian corpuscles are responsible for vibration, whereas Meissner's corpuscles are rapidly adopting mechanoreceptors for touch on non-hairy skin. Hence, the answer here is A. Ruffini's. Question number 4. Transfer of genetic material from plasmid to plasmid is A. Conjugation, B. Transformation, C. Transposition, and D. Transgression. And the answer is C. Transposition. Conjugation is a process of transmission of material from one bacteria to the other. The donor cell initially attaches itself to the recipient and later comes in contact, after which one strand of plasmid is transferred to the recipient, and eventually complementary strands are synthesized and the two cells separate. The cell which transfers the plasmid material is the F-positive cell, whereas the one or the recipient is the F-negative cells. Transformation, on the other hand, is when an external DNA is incorporated into the chromosomal DNA of the recipient, giving result to a genetically transformed cell. Transposition, on the other hand, is when the material from one plasmid is transferred to the other plasmid, and this is called transposition. Moving on to the next question. Asthma, aspirin sensitivity, and nasal polyposis together is called A. Church-Strauss syndrome, B. Dressler's syndrome, C. Carter-Jenner syndrome, and D. Samter's triad. And the answer is D. Samter's triad. Church-Strauss syndrome is an eosinophilic granulomatosis with polyangiitis. It is an autoimmune condition which is rare and causes inflammation of small and medium-sized blood vessels, that is vasculitis. This may also cause airway allergic hypersensitivity or is seen more often in patients having the history of airway allergic hypersensitivity. Dressler's syndrome is a secondary form of pericarditis that occurs in the setting of injury to the heart or the pericardium. It consists of fever, pleuritic pain, pericarditis, and a pericardial effusion. Carter-Jenner syndrome or primary ciliary dyskinesia or immotile ciliary syndrome is a rare syndrome which is autosomal recessive and causes defects in the action of cilia. Samter's triad is a typical triad of asthma, aspirin sensitivity, and nasal polyposis. That is about it for today. Hope you enjoyed today's session. If you have any recommendations for us, kindly post us on the comment section or email us at infocular@gmail.com. We'll be catering to your demands. Hope you have a good day. Happy reading.